Hello and welcome to Askimo TV. I'm talking today to Dr. Norman Briffa. Dr. Briffa is a consultant cardiac surgeon at the Northern General Hospital in Sheffield and senior lecturer at the University of Sheffield in the UK. Hi, Dr. Briffa. How are you?
I'm very well, thank you.
Great to hear. Dr. Briffa, we're going to be talking today about heart valve surgery, including minimally invasive heart valve surgery. So I'm going to start off with, for what conditions would a person require heart valve surgery?
The two commonest conditions are stenosis or narrowing of the aortic valve, which is the valve between the left ventricle or the main pumping chamber of the heart and the aorta. And the second commonest, or another common condition causing heart valve disease, is when the mitral valve, which is the valve between the left atrium, which is the receiving chamber of the heart, and the left ventricle, which is the main pumping chamber of the heart, when that valve, the mitral valve, leaks. So those are the two commonest conditions that require heart valve surgery.
How can people prepare for their surgery, or how should they?
Well, it's important that usually patients are on the appropriate drugs, so it's important that they carry on taking the drugs that have been prescribed for them. If they smoke, they really ought to try and stop smoking, because it's important your lungs are in good shape when you have any type of chest surgery on your chest. And that's about it, really. And just try and keep fit. But the trouble is, many of these patients are not fit. That's why they're requiring surgery. But certainly keep taking the drugs that you've been prescribed, and stop smoking are the two things that they can do to make sure that the outcome is good after the surgery.
Talk me through the surgery options for heart valve disease and what happens in these procedures.
For certain, the options for the operation itself, you can opt for minimally invasive surgery, but one of the other choices a patient has to make is to decide what type. If the valve is going to be replaced, which happens in the majority of cases, you have to decide what type of artificial valve you're going to have, because there are two choices. You can have either a mechanical valve, and the benefits of a mechanical valve is that they are very sturdy and they will never fail. The disadvantage is that you have to take an anticoagulant drug like warfarin for life. The other option is to have what we call a biological valve, and that looks like a natural human valve. And the benefits of that is you don't have to take warfarin. The disadvantage is that if you're young, these valves tend to wear out with time. So those are the two.
What happens after the surgery? How can people recover as quickly as possible from surgery, and will there be any changes that happen to their lifestyle?
Yeah, the first few weeks after surgery, well, after any major surgery, patients tend to feel very tired, and because the surgery involves an incision in the chest, you are limited to how much weight you can carry, for example, and things you're not able to lift stuff. So, patients just have to take it easy. They have to carry on doing breathing exercises to make sure that their lungs recover. So it does take a bit of time, but eventually, after a couple of months, patients tend to get back to full fitness.
And after those few months of recovery, do things go back to normal? There's no sort of lifestyle changes that people will have to consider long term?
Well, if a patient has a mechanical valve, then clearly they're going to need to take warfarin, which is the anticoagulant, so that's a new drug that they have to take. But no, eventually, patients get back to normal.
Great. And tell me, are there any risks, and what are the risks, if there are, to surgery?
The risks of surgery, of any open heart surgery, is death, although that's very rare. The other big risk is sadly a stroke, but again, that's very rare. But those are the two big serious risks of open heart surgery.
And just to end off, what is the prognosis for recovery after these surgeries?
It's fantastic. And if patients tend to recover fully, they get back to full fitness. I've had patients who've run marathons and have become strong and fit after the surgery.
Thank you, Dr. Briffa. Thank you so much for talking to me today.